So we are following a developing story surrounding yet another health scare. In this case, it pertains to E. coli. We now know that one person has died and at least 38 people have become ill following an E. coli outbreak linked to organic carrots. Yeah, believe it or not, carrots. The Centers for Disease Control and Prevention said yesterday that the cases emerged between September 6th and October 28th across, count 'em, 18 states in total, with Washington, Minnesota, and New York reporting the highest number of cases. Joining us now to discuss all things surrounding that and so much more is Dr. Mina Merholm back here on the Fox 5 Live Zone. Doc, always good to see you. Welcome back to the show.
Likewise, Guy. Thanks so much for having me back.
All right, so this is scary. Let's just get right to it. Yet again, I think back to a couple of weeks ago, we were all thinking about quarter pounders, which I love, by the way. But if you happen to bite into one that had raw onions, well, you could very well have suffered from E. coli. Fast forward to today, and dear God, Doc, I love carrots as well. But yet again, we may face coming down with E. coli. What should we know about this?
Yeah, here's the thing. Just when we were saying, you know what, avoid fast food, let's eat our broccoli and carrots. And now it turns out, as you're mentioning, there is some scary things there as well. So the first thing that we should be aware of is that this is a particular brand from one company, but it is sold under several wholesale or company specific, like Trader Joe's and others. So the first thing I would want folks to keep an eye on is perhaps this is a time to stay away a little bit from these organic carrots until we get to the bottom of, the E. coli scare, because this is something that can be potentially not just make you very ill, but can actually potentially be lethal as well.
Yeah. So what are some of the side effects or effects one would start to see as a result of, let's say, eating something like this and then coming down with E. coli?
Yeah, initially what you'd see is typically what you would find in several other infections. You can have a fever, nausea, vomiting. In particular, though, you want to watch out in E. coli is you can have a kind of diarrhea that can even turn bloody. So if you're beginning to feel particularly ill and the fever is spiking even higher and you're getting these changes in the stool, that's a time to be really careful and reach out to a provider immediately, because this could become very dangerous at that point.
Is it fair to say that this can affect one more than another? In this case, let's say adults more so than children, or children more so than adults, the elderly, what have you?
Yeah, that's a great question. Whenever we're thinking about these kind of outbreaks, and now there are several, as you mentioned, we want to think about the immunocompromised or vulnerable populations. If you're somebody who is in the elderly population, very young, or you're dealing with immunocompromised disorders for other reasons, cancer is another one, or if you're someone who works closely with those who are ill, like healthcare workers. So those are all areas where if you're more vulnerable for infection, generally speaking, you want to be particularly careful around an outbreak like this, because it can make you more likely to be susceptible to these diseases as well.
Yeah, all right. Well, yet again, somewhat concerning because, dear God, I love carrots. And so now I have to make sure I'm extra careful when I go about to enjoy them. Let's move on to another concerning issue, and that happens to be the rise in measles cases right here in the United States and throughout the world, quite honestly. In 2023, some 10.3 million measles cases were reported globally, marking a 20% increase from the previous year. Now we know the World Health Organization attributes this rise to insufficient vaccination coverage. I'm curious, one, to find out something like this is still occurring in 2024, is that unusual? And two, how do we get a handle on this?
Yeah, great question here, Guy. This is one of those cases where a preventable disease that has been on the rise for really a couple of public health issues. One is the scarcity of the vaccine itself. And as we're seeing in our country nowadays, there's a conversation around whether or not there is safety around these vaccines. And the medical community has been unequivocal regarding the safety and efficacy of these vaccines. And sometimes when we are not, as a community, on the same page about that, that can also contribute to a rise of these infections. The MMR vaccine, the one for measles, mumps, and rubella, has been around for a long time and has been very effective. And for us, as we're preparing and seeing the rise of these cases around the world, we want to be extra vigilant to encourage one another to make sure that our children are vaccinated properly.
Yeah, I'm glad you touched on children. I'm looking at my notes here, and it says over 22 million children missed their first dose of the measles vaccination last year. The question is, how could that be? How could mom or dad allow that to happen?
Well, there's a couple of reasons here, Guy. One of them, unfortunately, is there is persistent misinformation regarding vaccines. One of the most commonly cited and debunked over and over and over again now is that this vaccine can be linked to or cause autism. And this has been unequivocally debunked and is certainly not true. However, there is still a timing where patients are saying, well, I know someone, a friend of mine, who when their child got diagnosed with autism, it was around the same time that you would typically have the measles vaccine. And the unfortunate reality here is that we're getting much better at the diagnosis and the detection of autism, and we are knowing at the same time that there is no correlation between the vaccine and autism. However, this misinformation persists. It's one of the reasons I'm glad that we're talking about this afternoon.
Yeah, and correct me if I'm wrong, but measles happens to be one of the most contagious viruses out there. Is that right?
That's absolutely right. And this is the sad reality is it's incredibly contagious, very debilitating, and very dangerous. And yet, when we have a situation where there's a spread of a virus and there's nothing we can do about it, or we don't know why it's happening, or we don't know where this came from, and we throw our hands up and hope for the best. But in this situation, we both have the prevention in terms of the vaccination, as well as the public health conversation to make sure that we are well informed as patients, to make sure that we're not having our children in this situation where they can contract this preventable disease.
Yeah, I remember that good old cartoon G.I. Joe, knowing is half the battle, and now we know. So we truly appreciate
That's
you
right.
providing us with that information. Once again, Dr. Mina Merhome joining us right here on the Live Zone. Thank you for your time, sir.
Thank you for having me, Kyle. Always a pleasure.